Have you ever seen a dog that clearly looks like it's in diabetic ketoacidosis, but then the blood gas comes back with normal or even elevated pH? If you haven't, you might be missing diabetic ketoalkalosis, a sneaky form of DKA that traditional criteria won't catch. Why does it matter? Imagine a vomiting dog with previously diagnosed diabetes mellitus arrives at your ER. The dog looks classic for DKA, lethargic, dehydrated, clearly very sick. But your initial venous blood gas shows an alkalemic pH of 7.51. Without knowing about diabetic ketoalkalosis, you might mistakenly rule out DKA completely based on that elevated pH alone. However, if you check the serum ketone levels with a handheld device and calculated the NI gap corrected for low albumin, you'd immediately recognize severe ketoacidosis, dramatically changing your conversation with the owner and your treatment approach. If you're relying solely on traditional criteria, such as pH less than 7.3 and bicarbonate below 18 millimoles per liter, you could miss a significant proportion of DKA cases. Missing these patients may delay treatment and worsen outcomes, leading to longer hospital stays. Let's break it down clearly. Traditionally, DKA is diagnosed with three main criteria: high blood glucose, over 200-250 milligram per deciliter, greater than 11 or 13.9 millimoles per liter, positive ketones, and evidence of acidosis, meaning a low pH under 7.3 or so, and bicarbonate below 18 millimoles per liter. But here's the thing. A significant number of DKA patients just don't fit neatly into these traditional criteria. And this is because they might have other forms of DKA that are well described in human medicine, such as diabetic ketoalkalosis, meaning they have DKA, but their blood pH is actually high, over 7.4. Neutral or mildly acidic DKA with pH between 7.3 and 7.4. And this is in contrast to traditional acidemic DKA, which you're already familiar with, where pH is less than 7.3. Diabetic ketoalkalosis was first described back in 1976, and while initially thought to be extremely rare, it turns out to be much more common than we previously realized. A DKA patient can have a normal or even high blood pH because of coexisting disease processes with alkalizing effects, such as vomiting, functional ileus, or respiratory changes, which mask the underlying ketoacidosis. Also, let's not forget that patients with DKA can even present as euglycemic DKA, meaning their blood glucose is normal or below 250 milligram per deciliter or 13.9 millimoles per liter. This is particularly relevant in cats treated with drugs like sodium glucose cotransporter 2 inhibitors, SGLT2 inhibitors. So in theory, you may encounter a feline patient treated with SGLT2 inhibitors that presents with DKA despite having normal blood glucose levels and a neutral or even elevated blood pH. Isn't it crazy? One of the best ways to catch these tricky cases is by using a handheld device to measure blood ketones right at the cage side. In human medicine, a beta oxybutyrate level of greater than 3 millimoles per liter has been shown to reliably identify severe ketoacidosis with an impressive sensitivity of 100% and specificity of 94%, regardless of the blood pH and glucose level. A relatively recent human study from the Journal of Emergency Medicine showed that if we rely only on the classic criteria, we're missing a significant chunk of DKA patients. In this study, researchers used a practical 6-step method for analyzing mixed acid-base disorders. They calculated the NI gap in all cases, regardless of blood pH, adjusting it for albumin. Also, they calculated the delta-delta gap or delta-delta ratio to detect hidden disorders like metabolic alkalosis or non-NI-GAP metabolic acidosis. They evaluated pH and PCO2 to determine the primary acid-base issue. They assessed respiratory compensation with formulas like Winter's formula to check if compensation is appropriate. And they calculated effective osmolality to detect additional underlying abnormalities. Finally, they analyzed the underlying pathophysiology to figure out what's causing these disturbances. By the way, I teach these steps in my free workshop that you can access by clicking the link below, located in the description. In simple terms, here's what they found in this human study. First, they looked closely at blood gases from these cases and broke them down by pH. Of all 227 cases, about 49% had traditional acidemic DKA with pH equal to or less than 7.3. 28% had mild acidemia or neutral pH in the range of 7.3 to 7.4. Finally, 23% or 53 patients had diabetic ketoalkalosis with pH greater than 7.4. Importantly, all these cases had increased NI-GAP metabolic acidosis, even the ones with normal or elevated pH. Of the 53 ketoalkalosis cases, nearly half had concurrent metabolic alkalosis, over 80% had respiratory alkalosis, and about 11% had respiratory acidosis. Certainly, these DKA patients would be easily overlooked if you're relying solely on pH and bicarbonate. So, does this happen in our veterinary patients, dogs and cats? Although there is a significant lack of research with respect to this topic, a couple of papers caught my attention. A recent veterinary study by Cuddy and colleagues evaluated acid-base disorders in diabetic dogs and cats with ketosis. They included cases with blood glucose over 200 milligram per deciliter or 11.1 millimole per liter, confirmed diabetes mellitus, and positive ketones in urine or blood. The researchers used traditional acid-base analysis, but unlike the human study we discussed earlier, they did not correct the NI-GAP for albumin, nor utilize the delta-delta ratio gap analysis. They found that 58% of dogs and 80% of cats had metabolic acidosis, either alone or mixed with other disorders. Primary metabolic alkalosis was rare, seen in about 4% of dogs and 7% of cats. Interestingly, traditional analysis showed a completely normal acid-base status in 20% of dogs and 7% of cats. But here's a critical detail. Hypoalbuminemia was present in about 30% of dogs included in the study. Since they didn't correct the NI-GAP for low albumin, many cases likely had falsely reduced NI-GAPs, potentially leading to missed diagnoses. The authors concluded that diabetic animals with ketosis and normal or high pH highlight a need to reconsider terminology. Terms like diabetic ketosis or diabetic ketoalkalosis may be more appropriate. Finally, they underscored that it is important to recognize that DKA patients commonly have complex and mixed acid-base disorders, and awareness of this is crucial to avoid misdiagnosis. Another veterinary study looked at 60 dogs diagnosed with DKA, defined by high blood glucose over 250 milligram per deciliter or 13.9 millimoles per liter, glucosuria, and ketonuria. Out of these 60 dogs, 2 cases had mild alkalemia with pH values of 7.491 and 7.487. Their bicarbonate levels were somewhat low at 15.6 and 17.3 millimoles, along with decreased PCO2 at 21.4 and 23.8 millimeters of mercury, suggesting a primary respiratory alkalosis driving the pH levels up. However, both dogs had significantly elevated beta hydroxybutyrate levels at 6.9 and 3.5 millimoles per liter, respectively. Unfortunately, since the authors didn't perform advanced acid-base analyses like the delta-delta gap or corrected anion gap, they couldn't fully capture the complexity of these mixed disorders. All right, so what is the bottom line here? Relying solely on pH and bicarbonate in pets with DKA is not ideal. Always check the anion gap and correct it for albumin if possible. If it's high, suspect DKA regardless of pH. Measure beta hydroxybutyrate levels or ketones with a handheld ketone meter in any sick diabetic patient, regardless of blood pH. If it's over 2.5 to 3 millimoles per liter, you're dealing with severe ketoacidosis no matter what the pH says. DKA doesn't always follow the textbook. Diabetic ketoalkalosis is real and easily missed. Look beyond traditional criteria. Use anion gap and ketone levels. You'll save lives, catch more cases, and improve your patient care. All right, thanks for tuning in. If you found this deep dive into diabetic ketoalkalosis helpful, drop a comment below and let me know your thoughts. Also, I need your help choosing the next research paper we'll cover. Vote for one of the papers displayed on the screen. And I'll see you in the next video. Take care, everyone.